So, Zeph, to start this conversation,
The questions are not gonna be tough.
if you are able to ace the
I don't know
nursing
what
test,
to look there.
then this is gonna be so easy because it's about things that you do every day as a nurse.
Oh, good.
Okay.
Now people are going to evaluate me whether I'm good or not, right?
You will do good. You'll do good.
All right.
Yeah,
Yes.
okay. So let's start with asking you. I think a lot of people probably have misconceptions or conceptions about who a nurse is. So, in your experience, what is the role of a nurse?
Okay. So, well, it's to describe nursing as a career. It's a huge, or I could say, it's a topic that would take days or hours to explain.
Okay.
Because it's one of the diverse profession, very diverse. You can work in the office as in doctor's office. You can do so many things. Even nurses work in insurance where they help with the billing stuff and that kind of stuff. So it's one area that is so diverse, and it is good also to tell people what nurses really do,
Because all I think of myself when I think of a nurse is someone comforting somebody in bed
Okay.
and giving them meds. So yes, I'm so glad we are talking about this. So tell us the variety of the jobs that a nurse
Okay, maybe
does.
I can begin by explaining what I've done myself personally. Maybe that can explain.
Fair enough.
So as a nurse, you can work, or I could say in acute area. When you say acute area, you are talking about hospital where patients are admitted either for infection, heart problems, so many other conditions that can take somebody to hospital.
So that's called acute nursing?
Yeah. When you go there, maybe you have an infection on your leg and you are supposed to be treated with antibiotics like IV antibiotics or whatever, or maybe control your blood pressure. Maybe you have asthma attack, you have breathing problems, and you need to be attended to in a very close care, kind of. So the nurses and doctors will be there. Now, the role of a nurse generally, let me say, bedside nurses, because there are so many. Like I said, nursing is a very diverse profession.
Okay.
So a bedside nurse will be with the patient the entire hospitalization time.
Okay.
Meaning that you're not entirely staying in the room with the patient, but you are frequently checking the patient, maybe every hour or so, to make sure that the patient is doing well. You are administering medication. You are checking if there will be any changes, maybe by measuring things, checking vitals, checking the blood sugar, all these things. And if there is a person who is the first person to catch things that are going wrong with the patient are the nurses.
Okay.
Because if I go and assess my patient, blood pressure is running 170 or 180 over 100, then I know something is wrong.
Okay.
I need to treat the patient using the protocol, or either notify the doctor about things that are not going all right, and then the doctor can address the problem.
Okay.
So without the nurse, I don't know what the doctor can do, because the doctor cannot treat the patient and stay at the bedside to see if the treatment is effective.
Okay.
So I wouldn't go into details about other things that we do, giving people blood, transfusion, name them. There are tons of things.
Okay.
Okay.
So is that just like when you describe, is that acute nursing?
That's acute nursing.
Okay. So what are other? You said insurance.
So you can
billing.
Also work in things like that as well. I don't have
experience
there.
Yeah.
mostly where I've worked in med-surg, which med-surg actually is a medical surgical unit.
Okay.
So patient will probably go for or
Surgery?
admitted from ED emergency room because they are sick, their blood pressure is uncontrolled or things like that. Then they are admitted into medical surgical unit.
Okay.
Or maybe they get operated and then they are brought into medical surgical unit
To recover.
Okay. Or to receive treatment with antibiotics or many other medications.
Okay.
But I could as well. I've also worked in a cardiac, where I like the most than anything.
Okay.
And here you manage things like cardiac issues, like heart attack, any thrombosis, sometimes things like that. So that's where you run cardiac drips and things like that. You're monitoring arrhythmias and things like that. Nurses can understand more because it's their line of practice.
Okay.
But all I'm saying is that nurses do a lot. There are nurses who work in ICU more. It's intensive care unit. Patients could be intubated. Like I said, there are a lot of things in
that
nursing.
you could do.
I can't even explain. I don't know everything in that because I've never worked in those areas. Yeah, but it is a lot. If you don't want to be a bedside nurse or a nurse who deals with the patient directly, you can also work in other things like offices. But
offices doing what?
Doing maybe you're working with the insurance companies.
So billing, helping billing.
Yes.
Okay.
Or you are doing the what do we call placement kind of stuff where you are working to find advocating for the patients or looking for places where the patient can go after hospitalization. Okay. Which is more like the case management.
Okay. So that's more books and administration and stuff
more
like you're not doing.
You can do management as well,
How about phone nursing? Is there like a role like where just people call?
Oh yes.
So you don't have to see the patients, but you're just like giving advice or recommendations on the phone?
Yeah, in the hospital, or maybe what did I say? So sometimes in clinics, or some doctors would have their patients, and they don't want to get a direct phone call from the patient. So they would say, "Hey, call the nurse." And if they call me asking a question that I'm within my
expertise,
within my line, things that fall into my practice. So I can give the advice and say, hey, this one you do this way, this one you do this way. I don't need to tell the doctor. But if the patient wants to see the doctor, then I'm going to ask the patient, hey, what did you want to see the doctor for? And then I evaluate the problem, if the problem is what did the doctor, and But like I said, in these settings, maybe the nurses will be answering the phone calls and stuff like that. Maybe they don't see the patient directly. Yeah.
So for anybody who wants to become a nurse and bedside manners is not your greatest thing, then there are options.
You can think about so many other things you can do as a nurse.
Okay, thank you so much for answering that. Which brings me to the next.
Or maybe go to advanced nursing.
Okay.
If you don't really like that.
Bedside, because it has more options than taking care of a patient.
Yeah, but
in bed.
Generally this is my own personal belief that if you want to get a lot of experience, as the higher you go, you better get this knowledge because it's going to help you when you're relating to other people or even people who are working under you. If you are a nurse manager, and if you are telling the nurses that are working under you, hey, this is how it's done. I've seen it this way. People tend to listen to you better because you are talking out of experience.
Yeah.
But if you just went up there and you are telling me, how to do the NG tube and
You've
haven't
never done
it
it
yourself.
Yeah.
So, you see there is a kind of disconnection there.
I agree. I
Yeah.
would agree. So, which answers my next question. What are the misconceptions that people have about nursing? I guess that's one of them, that nurses always, the only thing they do is take care of a patient
Okay.
in bed or something like that. Yeah,
Okay.
Right? Yeah.
So, it is something that as in America they understand better
What do they understand better?
what the role of nurses.
Oh, the role of a nurse? Yeah.
Yeah, because in one way or another you've seen a nurse, you have a family member probably who is a nurse, or maybe you've been to hospital or you have had a family in the hospital, so you will know what exactly nurses do. But there is a general misconception, especially, I don't want to stigmatize, or maybe just a stereotype, not stigmatize, stereotype people. But I've seen people writing sometimes on social media, perceiving what the nurses really do.
Like what?
Like they could be saying, "Oh, you taking care of dead people. You taking care of,
so
some say, okay,
hospice nursing.
Yeah, there is also hospice nursing, but not every nurse is an hospice nurse.
Yeah.
Yeah. Or maybe they think you take care of old people. Not every nurse works in a nursing home. Most nurses work in the hospitals. But if you work in a nursing home, that means you like
taking care of that population.
And
there's nothing wrong with it.
There's nothing wrong with it.
Yeah.
You're making money.
Yeah.
You're not gonna look for a job there and get hired without qualification. You have to pass
You went to school.
You have to go to school because there are certain requirements that are needed before you do that job. So I would say it's that kind of backward thinking because you don't really know what you are talking about.
Okay.
Yeah.
So do you think people just put nurses down? They don't appreciate them when they are talking in social media, as in they do dirty jobs?
They could put you down, but they love your money.
Oh.
Yeah, they love your money. I'm not trying to glorify nurses better, but I would say, tell me an accountant who beats a nurse in salary. Tell me. I mean, I give you a challenge. I live in US and I know what it is. Tell me. You
know what? There is a saying, I don't know who said this, that opportunities are passed by many people because it comes in an overall.
Yeah.
So some people think like, okay, this is not an opportunity because they think it's dirty and all that.
Yeah.
Yeah. Okay.
Yeah. So people people know what they are doing. I've seen nurses transforming their families and doing things that are really big because
of the money that they earn.
Yeah, and it's worth it. If you work for 3 days in a week, you're getting money, so it's helping you. It's helping your family.
Oh yeah. Definitely.
Yeah, but getting that license.
Is the process of
is the process which is
tough.
Tedious, and it's pain to be in a nursing school.
Why do you think they make it so hard?
It's because I can decide to be, let's say I decide to do electronics, right? Or maybe a computer technician. Do you think I'm gonna go to court if I damage a computer? While if I'm hired, for God's sake, maybe let's assume I get a job with Dell computer company,
or
and I damage 2 computers. Will they take me to court?
They probably will fire you. Maybe, I don't know.
Probably not even.
Or who you talking about taking you to court? The customer or the company?
Whoever.
Yeah.
Oh, you purchased the computer that has got some faulty issues. They wouldn't say that. Oh, who was
the engineer?
Who was the engineer? Who actually did the assembly or whatever?
Oh, so they're not gonna follow like to the T who did this.
Yes.
Okay.
But as a nurse, you are dealing with human life. So whatever you are doing, you need to remember that somebody's life is in your hands.
Yeah.
So you get the proper training. You need to get the proper tools to do your job good, and you need to know what you are doing. So and that is why the expectations are very high.
They make it harder.
And they make it harder. They really want to confirm or make sure that you know what you are doing.
Okay, that makes
And
sense.
and that's why I remember when we went to school, I think our class, if I still remember well, we started 60, and I remember our last class we had about only
20?
11 students.
No.
Seriously.
Wow. Was it too tedious? They made it hard.
People dropped out of the way.
Wow.
Throughout the way.
Oh, wow.
And some decided they're going to graduate at the lower level, like LPN
instead of RN. Okay.
Yeah. So everybody...
So it's actually to protect us.
Yes.
In a sense. Okay.
Yes.
So what are the qualifications to become a nurse for somebody who's watching? What do you need to become a nurse, to go to nursing school, or what qualifications do you need?
So now here is where now things get a little bit, I don't know how to explain, but in Kenya, they are based on your high school qualification. In US, and people can attest to this, people who are in US have gone through this system, and you too, you've gone through this system. When you go to a community college, which is generally the first 2 years of your college studies, when you go there, and when they ask for your high school certificate, it's just for formality.
That you
Nobody
graduated high school.
I've never seen anybody digging to say, oh, you had a D in math, or you had a whatever A. Even if you had those things, it is like they are testing you afresh. And that is why, unless you want to ask the college to transfer your credits, then they don't do the evaluation themselves. They will ask you to do the West company, where they evaluate your credits, and then the school can take that final whatever thing, and then they put it in the system. So
to translate it to what equals to the US credits.
So generally what I normally tell people is that you can have your D, Kenyan D, like you...
You heard that, people? So if you failed high school...
You can
still become...
a surgeon.
A surgeon here in America.
And people don't believe me when I told people because we Kenyans, we are obsessed with high school
grades,
which really don't make sense.
So this country gives you a second chance from your teenage grades, right?
But one thing that is kind of surprising is that even if you had an A in high school, it is not like going to be just, okay, so you pass in high school, so you are okay.
It's not a guarantee. You're starting over.
You're gonna still go through the same system.
Okay.
So I could be in the same class with somebody who had an A.
Okay. So the answer here is just to have graduated from high school to start nursing school. But they do have qualifications, right? Like once you start taking classes,
that's now where you are, where your grades really matter. Because you're gonna do biology before you do anatomy and physiology.
Okay.
So if you don't get a C, then definitely you will not go. I mean, these are prerequisite courses, so you'll not do anatomy and physiology if you did not pass biology or chemistry.
Okay.
So you will do all those courses: biology, chemistry, anatomy and physiology, and then you now keep building.
Okay.
And maybe you started as you wanted to be a nurse, and when you finish your maybe AA, they call associate degree, you decide, oh no, I think I want to be a doctor instead of a nurse. You still have a chance. Nobody will say, hey, you had a D in high school. No. We are now talking about going forward. So I've seen people like Dr. Ben Carson. Ben Carson had gone for, he was a sociologist. He did sociology.
In college.
In college. Is it sociology or counseling? One of the two. I don't want to be, but it's one of the two.
Okay.
But then, and he did his degree, and then he decided, no, I think I need to be a neurosurgeon. You can just imagine.
Switching from sociology to
psychology, I think so.
Okay.
And then
to becoming a neurosurgeon, which is very hard. Yeah.
Yes.
Yeah.
So something has to be done with our Kenyan system to open up
opportunities
and not to destroy kids, because just think about it this way. When you are a teenager, you're gonna make so many mistakes. And maybe you don't know how serious your education is when you are a teenager and you are sitting for a national exam like KCSE. So if you make a silly mistake and for God's sake you get a D, why would that determine your life, the rest of your life?
Yeah, it should not penalize you.
So if I am 20 or maybe 25 and I realize, no, I think I needed to be a doctor. So you're going to tell me, hey, go back to high school?
I know.
And that is why in Kenya that would be it. You got
like
no other choice.
Yeah, like if you fail high school, it seems. That's why people cheat.
Yes.
Because it's like the stakes are so high, but we are talking here in America, it's a good system. It gives you a second chance.
It gives you an opportunity.
An opportunity to start over as an adult.
Yes.
Right? Yeah.
Yes. So if I had a D and I was down, maybe my family didn't support me well. I got chased home because of school fees, and I didn't really have a good time to study.
Oh yeah. Or you had
I had some other social
psychological
issues,
that you can't handle as a teenager.
Yeah. And now that I'm an adult, I'm 25, and I know why I need to study hard and get a D. Get a A.
Not a D. Yeah.
So I can still become a doctor. And that only can happen in America, it can happen in Canada, it can happen in Australia, but not in Kenya.
So guys, welcome to America.
Yeah.
If you ever want to be a nurse and you failed high school and that was your dream or you want to change...
And somebody might lie to you and say, oh, it's going to be easy. It's easy to become a doctor or a nurse in America. No.
It's not.
It's tough. And that's why I say you find like 60 people start nursing school and only 15 graduates.
Okay.
Where are the rest? Where did they go?
Because it was tough.
Because it was tough. But the advantage is that you are studying as an adult, so you know why you are in school. It's not like when you're a teenager and you're in high school.
That's true.
So people shouldn't say, oh, because this guy had a D, then that D should stick with you forever.
I know.
You had a D because of your social problems that you had at that time, and maybe you didn't really know the reason as to why you were in school. But now you are an adult, you have your brains well, you have a chance, and that's why when you are striking A's.
That's good to know. I hope that information is useful. And if you want to become a nurse, you can start over here in America. So tell us, Zeph, so after you graduate from either community college and get your associates or bachelor's, what's the next process after that? How do you become a nurse after school? What's the process?
So after you graduate as a nurse, like RN, registered nurse, you need to sit for a state board exam, which is called NCLEX.
NCLEX, okay.
And some states would require, some states are compact states. Whereby
what does that mean?
It means that if I have a Arizona license, you can practice in New Mexico, you can practice in Iowa, you can practice in Texas, you can practice in so many other states.
Okay.
But you can practice in Minnesota because it's not a compact state. And I can't practice in California because it's not a compact state. So for me to practice in those states is either I apply for a temporary license or look for what they call endorsement, which is just a process of paying some fee, giving them your papers, and then apply for their license. It's not like sitting for an exam afresh, no.
Okay, so this is important after you graduate, wherever you graduate.
You need to get
you
the
choose
license.
you choose where to get your license,
Yes.
and most likely the best, or to increase your chances of employability and to use your license broadly.
So most people some people, I mean, it depends on where you live, you know. That's where you want to practice.
Or where you want to go in future too, right?
Yeah, so because personally I graduated in Iowa and I had Iowa license, which is a compact state, and that made it easy for me to practice in New Mexico. And when practice in Texas, I practice currently doing it in Arizona.
Okay.
So, it helps you moving around. And
so does that mean if you had like your NCLEX in Minnesota, which is not a compact state, if you move to Arizona, means you have to do an NCLEX?
You need to do you need to get the endorsement.
And how does that work? Is that like an exam?
It's
or
not an exam.
What is it?
It's application. You pay money, get a application process which involves sending your school documents and stuff like that.
Oh, okay. Just to show pretty much.
Yeah. I don't think some states, it's only California that require your school papers. But Minnesota, I applied for Minnesota license and they didn't ask me that. All they needed was the verification thing. That is all.
Okay.
And then the background check.
Okay.
That's all.
Okay.
And then you pay the fee.
Okay. Is it hard to pass the NCLEX exam?
For somebody who studied in US, NCLEX is a tricky exam.
Why is that?
It tests your critical thinking.
Okay.
So if you go there with exam passing mentality, you probably won't pass.
Give us an example. For those of us who don't know.
It's so difficult to give that example. People may not understand. But what I'm saying is, let's say something happens so quick and the patient is just about to die. What are you going to do?
Okay, so that's an
so
exam.
They test you that.
Oh, okay.
Because you don't need to panic, you're not going to call the doctor. But there is something that is so critical you need to do to save the patient's life before you even think of calling the doctor or whatever. Or maybe the incident that just occurred would require to call the doctor immediately, So they test kind of things
Those
that are more, how do you make your decisions in critical situations?
The process of your thinking.
Exactly.
Okay.
And then again, I think they also test to understand the knowledge. So don't think that everything is critical thinking.
Okay.
They will also test your knowledge. But the most important thing is critical thinking.
Okay. Yeah. So it's not hard if you went to school here.
If you went to school here,
but you think it might be challenging if you didn't go to school here.
It's gonna be challenging, especially people who study in Kenya. And I'm not drawing like a general conclusion. Our Kenyan system don't really focus in critical thinking. It focuses mostly in passing the exam.
Pass the exam.
And that cannot work in US because in US they kind of critical thinking focus.
I think it can work anywhere because even the Kenyan nurses, once you're in the floor, you need the critical thinking. You also need to make decisions for your patient.
Faster,
so probably our institutions are failing our nurses.
Yes.
Yeah.
Yes, because there are things that you even tell the doctor, hey, you need to do this. You need to do this. I mean, I'm doing my job, and my job is not doctor's job. Doctor has his own job.
But you have
I'm doing my job.
But you have more information about the patient.
Yes, I have the information. And if anything happens, and if somebody will go for deposition, I will do my own, responsibility. What did I do as a nurse, Things like that.
Oh, okay. So what kind of money do nurses make? Like the entry level. Let's say somebody just graduated from college.
Mm-hmm.
What kind of money do nurses make?
Well, it is so different.
Mm-hmm.
It depends on which city you are.
Mm-hmm.
It depends on what role you are doing.
Okay.
It depends on which state.
Okay.
And I could be working in the same floor,
Mm-hmm.
doing the same job with you,
Mm-hmm.
but I'm a travel nurse getting $70 an hour or 75, and you are getting 35.
Oh.
You're getting $35 an hour, I'm getting 75, and we are doing the same job.
Okay.
So it depends on how you really want to do your job.
Okay.
Some people will decide to, I want to be a travel nurse. A travel nurse don't get the luxury of getting these benefits like insurance.
So what's a travel nurse for somebody who doesn't know? What's a travel nurse?
Travel nurse is you sign up a contract, like 3 months contract, with an agency.
Mm-hmm.
So they can send you to Texas and say, hey, there's a contract. They're looking for PCU doctor, nurse, or they are looking for OR, operating room nurse, or they are looking for ED nurse, or they are looking for cardiac nurse.
Okay.
13 weeks contract, and they're gonna pay you per hour $75. They're gonna pay you per diem, meaning that the time where you are staying, rent and stuff, and for your food.
Okay.
For that 13 weeks. So when you tally all the benefits you're getting, it's a lot way better than somebody who is hired and working permanently
in a hospital
in one same location.
Oh, so would you say the range of a nurse is between? We're talking of registered nurse. Let's
Yes.
not talk about LPN probably. So from a registered nurse, 2-year college, you're talking of a range between what to what? What's the lowest that you know about, and what's the highest that you know about?
I would say generally it's about $30 for beginners an hour.
$30 an hour. Okay.
Yeah, and that's like putting a general. It
Generally,
could be
okay.
that there are people who are making 27,
Okay.
which is really
long.
bad.
So really bad is 27.
Yeah, but still,
the range is
if you
30
go to some
to
places,
what?
yeah.
Sorry.
If you go to California, you will find people who are making $50 to $70.
Okay.
Or close to that.
Okay. So it's 30 to 75.
Yeah.
You said? Okay. 30 to 75.
I mean, it depends. With the pandemic,
yeah.
People were making even $100 an hour.
Nurses are balling. So you've heard of people making $100 an hour?
Oh, come on. Of course.
Wow. That's awesome.
I mean, during pandemic.
Yeah.
During the
because you're
the
really,
COVID.
Yeah.
Yeah, people were making $10,000 a week.
Oh.
Which is like, how much in Kenya?
That's like 1 million.
1 million a week.
Yeah, 1 million shillings.
A week. That was during pandemic. So don't say that people are making that in
Yeah.
America,
Yeah, okay.
It was pandemic. I think
Opportunities.
we are heading up there now. There are still places that can pay you 7,000 a week.
Is that to take care of COVID patients?
Yes.
Oh.
It's because the hospital are desperately looking for nurses, and they don't have nurses.
Because that's the risk.
Because it could be, you may not be taking care of COVID patients, but it's because there are no nurses in the hospital.
Okay, and that's why that's why we're having this conversation about the career, because when people are choosing, like trying to consider their careers, this is a really good opportunity.
Yes.
Okay. So,
but if it's not your thing, just continue with what you are doing. You have to like what you are doing,
But you don't have to like it. You can just like it a little bit and do it for a short time, and then go to, like, you can use something you're good at and not like it. You can be good at.
Yeah. Because when you come here, if you are in Kenya and you really, I want to venture into nursing career in US, you need to leave that because I understand patients are not treated nicely sometimes, not all the time. So I'm not a stereotype. In Kenya, I hear some days go where nurses can just, hey, here's your medication, like yelling at you.
Oh, customer
The customer service in US is so high that you need to tell the patient what you're about to do. You're not gonna tie the patient and say, hey,
dawa yako.
Yeah.
Amuka.
That you are breaking the law already because you're now being
aggressive.
You're being aggressive. You are violating the laws because it could be, I don't know.
Yeah, that was
harassment.
That was gonna be my next question. That what are the cultural differences of working as a nurse? Maybe here, maybe I don't know. You are
so
not
all
a
the
nurse.
time you introduce yourself, of course.
Okay.
Say, hey, my name is so and so.
When you enter the room.
Yeah, I'm gonna be your nurse today.
Okay.
And the patient has a right to say, no, I don't want you.
What do you do?
You don't force yourself.
Has it ever?
Oh yeah, it does.
Oh, really?
Yeah.
So when a patient says, I don't want you, what do you do?
So
what is the protocol?
You go switch assignment.
Oh.
Yeah.
Is that like probably because of racism or?
Once, I would say in a blue moon, maybe I can count
the time
situation that kind of thing has happened. And maybe somebody is confused and can really make those decisions well.
They're sick.
Or maybe somebody is more comfortable with the female than the male.
Oh, so they have the right to refuse service.
Yes.
Okay. So so you come in. Hi, my name is Zeph. I'll be your nurse today.
And maybe whoever is exiting.
We'll introduce you.
We'll introduce you.
Okay.
No, it's time for me to go home.
Okay.
And so is going to be. You're gonna be in good hands. He's an experienced nurse. We'll take care of you. That's all.
Okay.
Yeah.
And then what? What else? It's like, how is the culture? Like, okay, so I've introduced myself, and then are there any other things that, like, give us a picture of how, a day of a nurse, process.
Number one thing, you never give a patient medication that you haven't explained. So you have to say, hey, I'm going to give you
malaria queen,
metoprolol,
metoprolol,
which is a beta blocker. Is going to help you control your heart rate because your heart rate currently is at 110 and we want to be
want to bring it down.
We want to bring it down. So, and tell the patient, when you take this medication,
this is what's going to do.
This is what it's going to do. And these are the side effects. So if you feel this way, if you feel dizzy, or things like this, it's gonna affect your blood pressure. We are not treating your blood pressure, but we are targeting to treat your heart rate. But because this beta blocker will also affect your blood pressure, you might feel dizzy.
This way,
you might feel, You're
preparing them.
Yes, so they know what is going to happen. But it's not like our culture in Kenya where you just give somebody medication.
You don't even tell them the name.
Yeah.
Oh, you don't even tell them.
And then you are like, oh, they gave me red pills. I don't know what they are. Yeah.
Yeah. Sometimes I call my mom. I'm like, Mom, we went to the hospital. It's like, umepewa dawa gani? It's like, oh, daktari amenipatia dawa. I'm like, what's the name of the dawa, Mom?
She doesn't even know.
Yeah, she doesn't know. I'm like, yeah.
It is so sad because, and I want to say this, and I'm not trying to paint Tenwek Hospital bad, but they gave my mom went there to get her ulcer treatment, and they just gave her depression medication.
Oh no!
So I was trying to find, because I called my mom and my mom was telling me, hey, I feel so dizzy when I take this medication. Yeah. But apparently they didn't even label the medication.
So you didn't know? Nobody even could read to see?
Yeah. Because we don't use those shorthands in US anymore. It is not accepted by the system. that, oh, the doctor wrote some medication and I can't read it. That is improper in US.
I think even
You have to type them. The patient has to read and know what medication they are taking. You're not going to say, oh, OD, you know, or you're going to say PO. What is PO? Well, I know it is by mouth, but is that a language for the patient? No, it's not.
That's
So
awesome.
tell the patient 2 times a day, not 1 time is 2.
Explain in a
What is 1 time is 2?
in a language. That,
Say 2 times a day,
okay.
in the morning and in the evening before bedtime.
Okay.
That's how you label your medication. How they label the medication in US. They label it, they put it in a bowl, which is a safety.
It has a safety cap.
Yes.
Yeah.
So even a kid cannot open it because you are supposed to push it down and then open it because of safety reasons. But they label it correctly. Not like the doctor writes shorthand for the patient. How will the patient read 1 time is 2? What is 1 time is 2? Or PO
Yeah.
1 time is 2. What is PO 1 time is 2? And you are writing it to a patient. You know, I think that is lacking brain. Or whoever is still controlling that kind of system of labeling medication in Kenya should really get some education. Because, well, you as a doctor, you understand that, but will your patient understand what you are writing?
Yeah, I think it's been my experience too. Whenever I'm in Kenya and there's hospitalization or going to the hospital, I feel like the patient is not empowered because of knowledge. Like even if you go to the pharmacy, it's like because of living here, I've had to ask the pharmacist, can you give me the printout of the side effects of this medication?
Yes.
Here, if you go to the pharmacy, the doctor gave you like
That's a rule.
Yeah,
That's a routine.
You must be. It's the law.
Yeah, it's the law actually.
It's the
If
law.
you, for God's sake, you went home and you overdose intentionally with that medication.
And the pharmacist actually before
so
you
the
go,
pharmacist would be in trouble because number one, you don't say, oh, because the doctor prescribed the medication, then I have nothing to do. No, you as a pharmacist as well,
liable.
You are liable. You
Yeah.
need to print out the explain whatever they're teaching about that medication.
Yeah.
And they ask you, hey,
Yeah.
have you been taking this medication? You say, oh no. Oh, okay, I'm giving you hydrocortisone. This medication you need only to use only 7 days. Just apply to the affected area like lightly. Don't put a lot. And you need to put on the gloves before you apply to the affected area.
And they also tell you, wanakuambia, do you have any questions? Like,
yes,
they really
offer.
take their time before they let you go with the medication. It's like, do you have any concerns?
It's just for safety.
Yeah. So I feel like the patient in Kenya is not empowered, and you take and put up with what you know.
Yes.
So,
and another thing is, so like when they gave my mom depression, then I asked depression medication. I asked my mom, did they ever ask you if
you're already taking medication?
If you are depressed? No, they didn't ask. So
they assume.
And then I assumed that they are still having that old 19th century mentality where they believe that ulcers is caused by depression. Or only depression. Yes, it can contribute, yes, but it's not the only factor nowadays.
Now it's bacteria.
Now it's bacteria.
Prioli,
and you need to find out whether it's bacteria causing the ulcers or it's alcohol or other social factors that could be triggering the ulcers.
Yeah.
So they just assume it's depression. Keep depression medication without explaining the patient not to operate on heavy equipment. Maybe I have my car outside there, I take the same medication, go, God forbid, get into accident.
I know. I think
Or maybe I cross the river, you gave me depression medication which affects my central nervous system and I start feeling like sleepy.
You know what? That reminds me my own experience. I think I had gone for a procedure. They were going to check. I had really bad heartburns,
Mm-hmm.
and the doctor ordered that they go like they put
Endoscopy.
a tube. Yeah, endoscopy. Yeah.
Mm-hmm.
So after the procedure, I had just driven myself to the hospital. It was gonna be, like not a big deal.
Mm-hmm.
They so after that, they would not release me to out of the hospital without somebody coming in to drive me out of the hospital.
Oh, that was the same thing with me.
Walikataa
So,
kabisa, it's
yeah.
like you're not gonna go anywhere until.
So when they were prepping me for that procedure, endoscopy, they told me, okay, you're gonna be nothing by mouth from midnight. Nothing by mouth. You don't drink any water. You don't drink anything. You don't eat anything until you are done with the procedure. You can drive yourself in when you're coming, but when you're leaving here, we need to see the person who is driving you back home.
So that probably is a difference between.
And I came to realize, because a buddy of mine came to take me, and I didn't know what was going on for hours. I thought I was smart, but I thought I was dreaming. How did we ended up in a Chipotle?
So you're still not conscious, like you don't
I
have
could
your
not connect. I could not. There was some disconnect with my memory. I probably knew what I was doing, but I couldn't remember what I did 2 minutes ago. So which was so unique. And when I got home, I slept completely. So those are some of the safety things that.
So here they are more cautious. Do you think because of the
cautious.
lawsuits, or they are just like more? What is it?
Well,
why is it in Kenya
like
that?
It's the regulations.
Okay.
So Kenya can give some regulations, but nobody adheres to those regulations.
So we don't follow up.
We don't follow up,
okay.
And which is really bad.
Okay. Have you?
And then again, let's say about this. Have you heard that people are being overcharged in Kenya?
Overcharged for
services in the hospital? Yes. Because somebody can be in hospital for 1 week ICU, and they say 1 million.
1 million.
And you just pay. In America, that cannot happen. Reason being, when you are putting a charge to any service that you offer, it goes to the insurance companies. And the insurance, they have, they know how much. Scale. Yeah, they know how much. For this if you say you did endoscopy, they know how much endoscopy they pay, how much endoscopy pays.
Or is it the.
Or MRI.
The negotiated rates too.
Yeah, or MRI. They have all those things labeled. So Kenya, somebody can just decide, oh, we're gonna do MRI for you, maybe, which is not necessary. But because even the insurance companies, they hired doctors. They have their own doctors. They have nurses hired by the insurance. And they can evaluate and say, hey, this patient came with a GI problem. So why did you do MRI?
Wheezy. Isn't that like right now they have like a lot of, they are talking about
malpractice and
not stuff. Even in Kenya they are talking about what is the insurance in Kenya called? NHIF. They are talking about a lot of fraud in NHIF.
NHIF.
Yeah. So
and somebody, I mean, we have educated people in Kenya, but something seriously is missing. Because we are stealing people's money by allowing that kind of fraud to continue. Yeah, because so the insurance will question. I mean, I remember they gave me ulcers for H. pylori after I did endoscopy. But then when I went to the chemist said, hey, this medication cost 1,000, which is 100,000 Kenyan shillings.
$1,000?
Yes.
Damn.
And then they said, okay, before we give you this medication, we will have to call the insurance.
To see if they can authorize it.
Yes.
Yeah.
So they did. And immediately the insurance said, they have their numbers there. They have all the numbers there so they can verify anything. And then the insurance say, okay, yeah, we can cover that. And they covered it.
Okay. I think it's the same thing with coverage right now with NHIF. I think they make phone calls and all that. Yeah. Can you think of any other difference in culture, in procedure, as a nurse here that you feel like it's really...
There's a huge thing here. So you prepping the patient for a surgery or anything. So there is education kind of that involves all that and that kind of stuff. And I know as a nurse that when a patient comes out of surgery, there are things that can happen. Number one, skin breakdown, because the patient is not moving the way he's supposed to be moving.
Okay.
So we need to reposition the patient maybe every 2 hours.
Okay.
And that should be within the scope of a nurse to understand that, even though doctors will order, hey, Q2 turn, stuff like that. You should understand, number one, that the patient is prone to pneumonia because they completed the surgery and the patient is not breathing well, maybe because they had maybe abdominal surgery and they don't breathe well because they don't have that capacity. They are laying down anyway. So, very high risk for pneumonia. Number three, this patient is immobile. Then they're gonna have blood pooling on the legs because the circulation is poor. Therefore, this patient will either develop DVTs.
What is that?
Thrombosis is gonna develop blood clots, which can cause PE, pulmonary embolism, or can even cause stroke.
Yeah.
And other things. And we've seen people dying from hospital beds, not because of what they really
came for.
Yes,
yeah.
for.
Okay.
But they die of other things that surround that procedure. And it happens a lot. And I think in US, people are really careful with that. They know when a patient is hospitalized, you need to have those prophylactic measures for PE and DVTs.
Okay.
To prevent blood clots. You're giving the patient, they call ISS incentive spirometer, to blow it and open the lungs and make lungs more active so they don't get issues like pneumonia.
Okay. So
things
that's
like that.
Okay.
And that makes a huge difference. And Mungu tu atusaidie tufikie hapo at some point.
I really feel very...
Because when you are really in the hospital, you know you are taking care of a sick patient. You don't want to create other problems while you are solving a problem. Yes.
I feel very educated now.
And your brain all the time is in your patient.
Yeah.
And that is why most hospitals, at most 4 to 6 patients.
So that they can manage.
That's your ratio. I complain if I'm given 5 patients. That's my max.
Okay, so that's another difference. Like the patient ratio here is... Oh, wow.
Yeah, and there is a certain documentation that I need to document daily. And my senior people will check those if I'm documenting right. Any activities, anything that involves the patient care, you document it. Because for God's sake, God forbid, this patient goes out there and sue the hospital and say, hey,
you're covering your bases.
Then you have the documentation of what we did every time we were doing.
So maybe in the end, really, this suing kind of thing in America, the end, really helps
It is helping.
It helps everybody.
Yeah, it covers the patient and it covers the hospital.
Yeah. So everybody ends up covering their bases.
Yeah. If the patient say, I need to give you Lovenox to prevent you from developing blood clots. Then the patient say, no, I don't want.
Then
I'm not taking that shot.
You have to document that.
You have to document that the patient was offered, but he or she declined. And you don't leave it that way. You say that the patient was given education.
What's going to happen
for that medication.
Because language court.
Yeah.
Negligence.
Yeah.
Yeah. Well, Zeph, I really feel very educated now. I hope my viewers, you have benefited from the information that we've discussed. We're going to cut this short. We will continue part 2. There's so much to learn about this, about nursing career. And I want to thank you for joining me today.
Thank you so much.
Yeah.
Thank you so much.
So see you in part 2. Please let me know what you think about what we talked about. Are you a nurse? Do you want to be a nurse? Please put a comment below this video. I will see you again next time. Until then,
Thank you.
bye-bye.